Good morning, I'm Amy Lynn. People living with common inflammatory conditions like COPD, asthma, and rheumatoid arthritis often need to turn to medications for long periods of time to help manage these conditions. But these medications cause significant bone loss and increased risk of osteoporotic fracture. Here with more on a new treatment for these patients is Dr. Ronald Emke. Good morning.
Good morning, Amy. It's nice to be with you.
So how many women in the U.S. are affected by postmenopausal osteoporosis?
Approximately 30% of women in the United States and Europe are affected by postmenopausal osteoporosis. Another way of looking at it, which I think is even more important, is every other woman over the age of 55 will sustain an osteoporotic-related fracture at some time in the remainder of her life.
What are some of the warning signs of postmenopausal osteoporosis?
It's a difficult issue because oftentimes it is silent. However, the most common warning sign is sustaining a fracture. Keep in mind that approximately 2/3 of vertebral fractures in your vertebrae are without any symptoms whatsoever. The other indication I like to look at is height loss, and that may be an indication that you're compressing some vertebrae.
So what are some of the treatment options for this?
There are several treatment options available, including Prolia, and your doctor really would be the person to talk with, because they know your total condition and they can tailor a program for you. But a balanced diet and exercise are always important in maintaining your bone health.
And doctor, what causes osteoporosis from certain medications such as prednisone?
The prednisone or corticosteroids actually can have a direct effect on the cells in bone, resulting in a thinning of bone as well as architectural changes within the milieu of bone that make it much more brittle and subject to fractures. So it's a direct effect, actually.
So what are some available treatment options?
Several options available, but the newest is actually Prolia, which gained a recent approval for this condition. And the issue is that every individual is different, and we have multiple other types of illnesses and problems, so our doctors are the person to decide what is the best treatment available for this individual case. So you need to speak with your physician about this.
That's great advice. Is there any place that you can send us for more info?
Yes, it's actually been available to all the physicians now, so your doctor or doctors will have that information and can explain it to you.
You can find out more by logging on to our website, fox4morningblend.com.